Good evening, friends. In continuation with the last week's webcast, so we'll be presenting this time with liver disease, chronic liver disease, the probable causes of chronic liver disease, how to know them, how to diagnose it, and what are the ways in preventing development of liver disease. So I thank the Lebron for having initiated such an initiative, and I think it's a wonderful to communicate with you and sharing some of the insights in prevention of chronic liver disease. So we look forward for more such series in the future. Okay. So chronic liver disease is one of the major healthcare impact full disease. So why I'm saying is that the WHO has predicted that chronic liver disease will be the number one killer in the next 10 years or 20 years ahead of us. So more people will die of chronic liver disease than because of heart disease or cancer. This is the truth. So the incidence of chronic liver disease has been increasing exponentially in the past 20 years. So when I started practice, so the proportion of people with liver disease will be around 10 to 20% of my outpatient. Now it forms almost 50% to 60% of my outpatients. So that really shows it is increasing in alarming proportions. So now, what are the causes of chronic liver disease? Before that, I'll tell you what I mean by chronic liver disease. We know liver is an important organ, and it is the biggest organ in our body. Liver weighs around 1.5 kilograms, and it is placed in the right side below the costal cartilage. Okay, so the functions of liver will be like it is the central organ for metabolism, like glucose, fat metabolism, vitamins, etc., and storage organ for majority of nutrients. And it also helps in the homeostasis, that is maintaining the body as a whole. So without liver the body may not be able to survive for more than 30 minutes or 1 hour. So it also helps in blood coagulation, and also it is a central organ for blood circulation, and it is in constant networking with kidneys, heart, and brain. So any disease affecting liver also affects kidneys, heart, and brain. Okay, so this is the vital importance of liver in our body. So let us come to what are those diseases which can affect the liver and can cause chronic liver disease. So when the normal liver weighing about 1.5 kilograms, is disorganized and contracted and reduced to size of a cricket ball, this is called as cirrhosis liver. Cirrhosis is irreparable reduction in the size of liver, along with distortion of liver architecture. So liver will lose its function by more than 50-60%. That is called a cirrhosis liver. And all liver insults, including drugs, toxins, viruses, all can ultimately culminate in liver cirrhosis. This is what I am telling as chronic liver disease. The cirrhosis liver has enormous implications. It can cause jaundice, abdomen swelling, we call that ascites, leg swelling, we call this edema, decrease in urine output, kidney failures, and it can impinge on the brain function, makes us speak slowly, reluctantly, and sometimes it may even result in coma. And more ominous is the blood vomiting. We call that hematemesis. It is caused by rupture of veins in the esophagus. The veins are the result of continuous liver shrinkage and enormous amount of pressure building in the liver veins, and it causes as dilated veins. It sometimes breaks or ruptures and can result in severe catastrophic blood vomiting. The vomiting will be around 1 liter, 2 liters. The patient may collapse before coming to the hospital. So this is very ominous, and now we have efficient endoscopic systems to prevent the bleeding and to arrest the bleeding. But still, what has happened has happened. So by all means, we need to prevent the development of liver cirrhosis and its complications. Okay. So before preventing, we need to know what are those causes that major causes. Before that, we need to know what are the major etiology for liver disease. The first major etiology is alcoholic liver disease. Alcohol is the number one culprit in causing cirrhosis. 40-50% of liver disease in India are caused by alcohol. So alcohol is a liver toxin. So some patients used to ask me, how much amount of alcohol is good for health, doctor? So I'll tell him, no amount of alcohol is good. Alcohol is a liver toxin, and any amount of toxin is injurious. So always abstain from taking alcohol. There is no permissible limit. If at all you want to have a numerical permissible limit, 30 ml of hard liquor in males and 15 to 20 ml of hard liquor in females are upper limit for safe alcohol drinking. Even then, it should not be continued for quite a number of years, because any amount of alcohol is a cumulative toxin. That means alcohol taken for so many years add up to cause the damage. It's not one time, it is the added up damage that can result in cirrhosis probably several years later. So alcohol is a liver toxin. So always we need to abstain from taking alcohol if you want to have a good liver. The second important cause is hepatitis viruses. B and C viruses are notorious in causing cirrhosis liver. B and C viruses nowadays are easily screenable. A simple blood test will tell you whether you have hepatitis B or C. In India, about 7 crore people are affected with hepatitis B and C. So it means that quite a lot of people are affected with hepatitis B and C. So it is identified by the simple screening blood test, and if at all somebody has a hepatitis B or C, it is now curable. So we have efficient medicine to cure hepatitis B and C, thereby preventing development of cirrhosis. And third important cause is drugs. So almost all drugs which we ingest goes through the liver for metabolism. So it becomes vulnerable for drug-related liver injury. So always have a second opinion for chronic drug intake. Suppose you are taking drugs for several years, always have a second opinion whether you need to reduce the drug or whether you need to monitor liver parameters before taking drugs for long durations. There are a certain group of drugs which can potentially cause chronic liver disease, and it has to be avoided. You always talk to your local physician or a specialist physician who advises you on long-term medications. Always be aware that any drug can potentially cause liver disease, and always keep them under monitor. Okay. Fourth important cause is hereditary causes. Suppose you have a family history of liver disease, either from your father's parentage or from your mother's parentage, you have certain amount of risk of developing liver disease, and while screening them, we can find out whether you have a risk of liver disease or not. If there is a risk, we have certain efficient maneuvers to prevent progressive or permanent liver damage. Certain conditions are amenable to therapy, certain are not amenable to therapies. So we need to weigh in accordance with the drug, with the disease penetrance and other manifestation, etc. Fourth cause is autoimmune hepatitis. This is an immunologically mediated liver disease. The body own immunity acts differently and can cause liver disease. It is also treatable if identified a little bit earlier. So the complications of liver disease, I told you, once cirrhosis develops, it is irreversible by any means. There is no drug available to reverse liver disease once it is done. So all efforts should be done to prevent development of liver disease. And the complications include ascites, bile edema, kidney failure, brain failure, and blood vomiting. So, summarizing, liver disease, number one cause of liver disease is alcohol, followed by viruses, followed by drugs and autoimmunity. Liver disease can cause reduction in the lifespan by having number of complications including blood vomiting, that is very dangerous. And prevention of liver disease is quite easy. If you have an alcohol habit, go to a doctor, get a counselor done, and abstain from alcohol by all means. So abstinence from alcohol saves you from development of liver disease. So please screen for hepatitis B and C with your local doctor. If at all you are positive, please get them treated. Third, if at all there is a family history of liver disease in your family, either from your parental father's line or from mother's line, please get a screening test done and treat them quite early. Autoimmune hepatitis, go to your doctor if you have liver symptoms and treat as early as possible. So by this we can prevent liver from becoming permanently damaged and going for cirrhotic change. So healthy liver is healthy life. Thank you.